and welcome to another episode on MFM's podcast, Post Call Beyond the White Coat, the podcast that takes you on an unforgettable journey into the lives of doctors. I'm Dr. Selena. If you have not followed our podcast, be sure to hit the follow button to follow our channel. In today's episode, we'll be exploring doctors in alternative careers, and our guest today is Dr. Muhammad Nazir, who has transitioned from clinical medicine to counseling and then now academia. So Dr. Nazir is an assistant professor in IIUM Kuantan, teaching health communications, health promotion, and health-related psychology. He has been with the university for over 7 years now, I think. He's a licensed registered counselor who offers freelance counseling services and is also a mental health advocate. This is actually a very, very interesting portfolio. Welcome, Dr. Nazir.
Yeah, thank you. Thank you, Dr. Selena. Glad to be here.
Okay, Dr. Nazir, maybe could you tell us a little bit about your background story, your journey through medicine? Because you were a medical graduate and you went to housemanship, but now you're in academia. I mean, you were in counseling and then in academia. What made you decide to hang up your stethoscope?
Well, rather really at the first point, it was mainly due to health reasons. I was diagnosed with depression and I started on therapy, taking medications, and attempted to return to work like quite a few times. And up to the point, I managed to work again for like a few weeks before something bad really happened during that experience. Was sort of like backstabbing, something of that sort. So I went into another depression, and that relapses again up to the point where I attempted to kill myself. And at that point, I was decided it's perhaps the time to say stop. And so I proceed to resign from housemanship and pursue my next course of action.
Okay, Dr. Nazir, if you don't mind, could we rewind and tell me about how, when you went into housemanship, what happened? How did the first bout of depression come about?
Right, okay. I think mostly the reason would be, it's not about the workload itself, because we all know the responsibility and the reality of working in hospitals and within the medical profession. We know that early on. The thing that I think triggers my depression would be the culmination of everything, and to the point that I question myself whether am I a competent doctor. And there's nothing really bad happened. I mean, there's no patient died at my hand, nothing of that sort. But it's just that whether I'm good enough. And then and that instance where I was told that I am not good enough, that really broke me up. So that was the trigger. Because whatever the thing that being mentioned by the doctor there sort of reaffirms my own doubts about myself.
When you said people who told you you're not good enough, by this you mean your superiors?
Yes.
Okay, so how did you go through that thing? Were you like all alone? Did you have people you could count on?
Alone mostly, because I think if you want to rely on your friends or colleagues, I bet like 90% of them are doctors as well, and mostly will be at the same place as you are. Then we don't want to disturb them or put more burden on them. So I was really alone by choice, meaning that I didn't seek any help or told my friends or colleagues who were working with me. Even my family wouldn't know that much, and not until I've resigned. So that's when everything comes out.
What was that point when you decided you needed help?
Basically, that's very early on actually, because I noticed that I'm having this thing that could be depression. So I went for help quite early on. In my first, like the first is like the third day when I didn't turn up to work, and that was like quite early on, because I was very into psychiatrics, so I know very well what I'm experiencing. So I just went and seek help.
Okay, what were you going through at that time?
Well, mostly about this sense of worthlessness. I mean, how feeling sad all the time. We just don't have any work. Any energy to do any work. And even on the way itself to the hospital, like there are instances that you crash your car, my car. I would like that those kind of thoughts. So I was a very reflective person. That's how I was trained to be during medical school. So I noticed that pattern of thinking, that pattern of desire. So I said to myself, like, you need some help. Let's go slowly to reach the hospital and discuss with someone superior and then get the proper help that you need.
Okay, did it occur to you? I mean, as you were going there, going for help and all, did this cross your mind that, oh my God, people are going to judge me, my colleagues are going to say I'm useless, and all these thoughts? Did it?
Um, Not really. I must say it was back a few years ago. That was in 2013. I wouldn't say I had those kind of thoughts because I'm very clear what I wanted to do because I need help. I mean, I really need help. And I don't think I was in that sort of fear to think about what other may think of me at that moment.
Okay, so what was your treatment or your therapy was like up until you were ready to go back to work again?
That's right. So I was taking on medication, so some antidepressants, and then I was sent for to the occupational therapist, if I'm not mistaken, for some deep breathing exercise, and that's basically it. If I can be honest, wasn't very happy with the treatment that I get. I don't think it's working to me, and I kind of force myself every time to go to the clinic, up to the point where I thought of self therapy, and I tried a few things like woodworking, doing some stuff, which helped me to just gain myself back some normalcy in my life before I decided to go and attempt to return to work.
Okay, and then what was it that made you feel like, okay, maybe I'm ready to get back to work?
Nothing really. I mean, if you ask me honestly, I think that time there's always this doubt. So I don't plan things without time. So you need to put some time. And let's say I'm gonna like recuperate myself for 1 month, and then by the end of that month, I will go in by hook or by crook. So there was a time when within that 1 month, I was very anxious to go to the hospital. So I went there at night. Just 1 to 2 nights, just go and strolling around, just to get myself accustomed to get the anxiety out of myself. And then starting to offer to help with menial tasks, just taking bloods and do simple kind of stuff where you don't have to like commit every or most of your time a lot, and you can just go away. And so I've been doing that, and then until I reached the time where I said I wanted to go in, so I went to go in. And mostly those kind of plan, I didn't really discuss. I wasn't discussing with my psychiatrist, unfortunately. But that's how I go on with it.
So it was more of a time-based kind of thing where you decided to go back into work, even though you are not better yet. Is that what you're saying?
It's hard to say because in depression you have this self-doubt. You feel yourself are worthless. You don't have that much confidence. You're down. You're low in energy, and if you have those package, you can't trust your brain. I mean, you can't trust your gut instinct at that time. You have to be very disciplined to yourself. And yes, ideally it would be if I can get my psychiatrist on board, and then he or she can give me an outside opinion on how I'm behaving or whether I'm prepared or not. That would have been better. But that was not the case for me. So I put the time as a discipline for myself. Okay, I don't want to drag my time further because time is always going to go. So I set myself a goal, a time when I reach that, I will go.
Okay, so what happened after that? I mean, you set that deadline. I'm going to get back to work on this date, and you started work again. And earlier you mentioned you had a second bout of depression. Like, what happened then?
I kind of refuse to answer that because I think that's basically that we relate to the person who's experiencing, because I think that experience is rather unique. But as a general would be, there are some patients that were not mine, but was led by my colleague that I was being reprimanded because not being responsible, and then have to do extra work as compared to what I have set in my mind to do for that day, because the context was I was still recuperating. So that I will set my working time for until 5 p.m. But I had to stay up until 8 to 9 for that patient, which it was not mine. And my colleague just returned happily from his or her break without knowing what had happened to his or her patient. So that's basically it happening. So I sort of like being pushed to take responsibility on something that is not mine.
Okay, did your superiors know what you were going through and if you were actually recuperating?
Not everyone. No, not everyone. I think at that time there was only like the consultant or specialist who's in charge of hospital at that time. I think he was the one who knew. And then I do have a mentor who's a medical officer, but I don't think she's very keen and wanted to be involved in the process.
Okay, would you say you did not receive the kind of support you thought your fellow colleagues as a doctor should have given you?
I wouldn't say what I expected from them because I know the situation they're in. What I think would be the case is that I perhaps didn't seek enough support that I needed. And the way that things are planned are not in the sense that multidisciplinary, whereby we got a psychiatrist on board or a psychologist on board and the hospital side on board, whereby you have this progressive return to work plan. That was not happening. It was just me planning on my own with my specialist, and that's it. And no one knows, no one acknowledges, and then that perhaps something that I could have worked on better, but unfortunately that's not the case. Because I don't think, in the way that you phrased the question, I don't think we should demand things. I mean, because everyone is within this hard time, not everyone is able to handle emotional or psychological distress very well. And because you need to have certain characteristics to be able to do so. So I understand they couldn't help, and I understand that they don't have the resources to offer help, and the responsibility would be on the person to seek help, meaning that if you can't find from your colleagues at the hospital, you should find it elsewhere. And that is not something that I did, which I wish I have done.
Okay, this is very, very profound because what I caught earlier, like what you said, is that whole progressive getting back to work. I think that is significantly missing in our system here because I did not have a progressive get to work back program as well, which I had to try to try to craft it out for myself. Yeah. So, what was it that, you decided that, okay, this is enough. Maybe this is not right for me.
Right. I wasn't quite sure what's next. And I was struggling with my mental health at that time. So the first thing I did was seek a psychologist for help. And I did that. and managed to get in touch. And she recommended me to enroll in a master program of counseling. So initially I wanted to do psychology, and then he said, you will do better in counseling because of the structure of the course and how they are trained. And I went into counseling, Masters of Counseling. It was at UUM, University of Utara Malaysia. It's mainly for gaining the knowledge and skills to understand myself better, and then how I can help other people who's perhaps experiencing the same thing as I did. And from that journey is where I learned about understanding myself with the tremendous amount of knowledge on our personality, our strengths, our weaknesses, what are your interests, what are your values, and those kind of stuff. And as far as I progressed in my study, I reflected back on my life. So that was how I learned. So everything was sort of like implemented or interpreted through my life. And I found things that are missing that prior to me enrolling to medical school. I mean, if I had known this early on, I wouldn't have gone to medical school.
So, what is it? What is it that you gained that you wish you had known before getting into medical school?
I see. Right. Okay. So basically, in terms of my interest, I'm more interested in social matters. So in terms of interest, you have 6 basically, as the theory goes, and my strongest interest is social. And you would have think, social is working with human, and doctors do work with human, but unfortunately, it's not the kind of work that how a person deal with human should work. For example, when you're in a ward round, do you have time to sit down and get to know your patient? That's not the case. So usually we just go and take consent. Actually, we're just going to take some blood for you. Is that okay? Okay, you just poke some blood, you take the blood, and then you buy. So that's basically it. So there's not much of human touch there. And when I reflected back on my experience working in the hospital, I can remember a few instances whereby my colleagues often call me to deal with difficult patients. I've got patients who refuses to go back home to be discharged. I've dealt with patients who, at the end of her life due to advanced breast cancer. I've dealt with patients with terminal cancer all on. So they've called me to deal with different kind of patients, and often the case, I was able to manage them, convince them to do something or manage their emotions. So I can see that was the part I was missing in my hospital experience. I wasn't very satisfied because I don't like being just go to the person, you do something, and just go back without the proper time to ask, understand them, their experience, their social life, who are their support system, and those kind of stuff. So I wish I knew that earlier on, and that would make a different career choice then. But I've never regretted. Just to say, if those kind of knowledge was available earlier on, I think I would have made a better decision as far as my study is concerned.
Okay, so what about now? With all that knowledge you're armed with, you've moved into counseling and academia. How does that relate?
Right. So because I do have sort of a short experience in clinical, and then I do have the knowledge of medical background. When I work as a counselor, mainly I'm very able to understand the patient well, because I know how the system works. I know sort of the illness that they have, and then the extent of impact of that illness onto their life. And I just need to understand other things about the patient. So the way I practice is very niche towards the healthcare setting. Either it can be a patient, or it can be doctors, it can be administrators. So those kind of people is someone that I be able to easily connect with.
Okay. So, you mentioned you've written a book about your experience with depression. Can you tell us a bit
Yes.
about it?
Well, basically, that book is the reason I wrote that book is because I couldn't sleep for 14 days. I was sleepless for 14 days, even after medication and whatnot. So one book, I think one of the self-help book that I read, it says, um, people are stressed because of insomnia, because they wanted to sleep, but they couldn't. So I decided to myself, I don't want to sleep. And I start writing books, finding things to do. So start writing, documenting my experiences, because basically I wanted to trace how have I progressed in my life up to the extent that I'm getting this depression. The second reason is I know when I experienced depression, I was very lonely. I didn't, I felt lonely. I'm not saying I'm lonely, but I felt lonely. No one understands me. So I hate for another person to feel that way. And if this book is around and easily available, then they may perhaps felt they're not lonely. Oh, there's actually this guy from out of nowhere being very candid about his depression. So hopefully that will give them this courage, like to really face their depression and to feel that they're not alone. And since then, I think I've been approached by quite a number, I think 140 something housements who's experiencing difficulties in their life. And due to that publication.
Wow, congratulations for breaking the stigma. Because, I mean, you've gone through this. What's the stigma like?
Um, Basically, I don't think we don't blame the older generations because they are not that aware like we are, and they can only decide things based on what they have experienced, and I think they have not get this sort of experience in depression, whereby usually the stigma would be depression is caused by something supernatural, which is perhaps prominent. I'm not sure in the Chinese culture. I think it's very prominent in the Malay culture. I was seeing, I remember I seen like 2 or 3 bomo already, because that was my father's belief, and that's one thing. Secondly, I think the stigma would be um, that mental illness is something that is created by that person. It's not, it doesn't exist. It's just, you just like malas, or you have some other negative qualities that you use as an excuse for you to be in the way that you are, and for you not to do your responsibilities. Then I think the stigma would be you are trying to seek attention. That's all. And perhaps that might be true in the sense that we do need attention, but they feel that you are seeking attention for unnecessary costs. And when you combine those three, it will turn out to be a non-productive interaction, which will not help you to go out of your current mental health state.
Wow, that's very, very profound because I actually do have a friend who went through depression and suicidal ideation because she was suffering bullying from her superiors. And yeah, she became a recluse. I have no contact with her. She's embarrassed to talk about it. She doesn't want to talk about it at all. Yeah, so it's refreshing to hear that, like someone like you can openly talk about it just to break that stigma.
Right. Yeah, I think it's very sorry to hear what happened to your friend, and it's not an easy thing to do. I mean, I remember I was trembling the first time I gave an open lecture about my depression. I was trembling, and then I had a very bad stage fright, so that didn't help at all. And so I kind of understand. You should appreciate that it is a very difficult thing to do, but it's not impossible to do. I mean, she should give herself some time and give herself some chance, like to, sorry, just to open up a little bit, and then she can just go back in to hide in her cave and just reattempt of going out and in until she's able to be outside.
Yeah, and the whole reason actually she's also one of the triggers for me to start Medic Footprints, because I wanted to help people like her. But at that point, I really didn't know how, because I just wanted to say, it's okay, clinical medicine didn't work for you. There are other avenues, other ways you can contribute back. But because I had no experience like outside of whatever I did, so I thought a platform where people can share and give back, that is the way to show her that there are other avenues. So yeah, I mean, I guess I have to thank her also for this platform, because that is also one of the main things that made me decide that, how can I help someone like her? And it's really, like I said, very refreshing to hear from your experience, Dr. Nazir, to openly and candidly talk about it.
I see.
Yeah. So, I mean, what would your advice be for young doctors who are going through depression?
Right. I think the first thing is seek help. And then for mental health, there are, unlike other medical illness, you have like a definite treatment. For mental health, you do have medical treatment whereby pharmacological approach. You take some medication, but the mainstay or the main approach for mental health therapy is psychotherapy. I mean, you should go and get psychotherapy. I think that is the thing that I liked the most during I was going through my therapy with the psychiatrist, and I think that's the one that is most eye-opening and most impactful to me. Because at that time, I think I only wanted to be heard, and that's not something that I've got from my psychiatrist, not something I got from my family and or even my friends. So to actually be heard is so refreshing, especially to individuals who have like a lot of talents and abilities. The fact that you graduated from medical school just means that you are above par. You're not like a normal person. You're like up there. So it's a pity if whatever you're experiencing like impedes you from being who you are. I mean, to show the talents that you have, the ability that you have. So that's perhaps what I would suggest for someone who's experiencing depression to do.
Okay, could you just share briefly, what is it that you did in psychotherapy?
Right, okay. Basically, and I approached a psychologist. Usually, a psychotherapy is all about talking. My psychologist was very facilitative in me to be able to express everything, and that makes a huge difference. And because after everything's out, I can really sit down and plan my steps further. And I was very motivated to go forward. And there are other forms of psychotherapy, so depending on the approach that the psychotherapist use, and there's no one way. So that's what's for me. Meaning, I was just being heard, and that all make all the difference.
Wow. Okay. I guess in this world right now where we are, everyone is not being heard. They are living alone and they are still scrolling through social media. So no one is really hearing them out.
think so. I think so. And that's perhaps the charm of social media. We felt that we are being heard through our likes and our loves and our shares. But there is a limit to that. People don't understand because people can interpret what we wrote differently.
Yep. So, okay, what about doctors who want to go into counseling or academia? How can they get into that?
Right. So basically, for counseling per se, it's because we already got a degree, so we can do a master program. It's a coursework based, 4 semesters, 2 years. But we have to do a one extra semester, a prerequisite. So we need to pass that prerequisite semester first before proceed to the 4 semester counseling coursework. And during that coursework, we will attend classes, and then you have a logbook that you need to complete. Just like our housemanship, you have to clock around 200 hours of counseling sessions with individuals and groups. And then once you finish your study, you will get a scroll, and then you will apply to the Board of Counsellors Malaysia to get your license. So that's basically the step. So there are a few universities that offer this Master of Counselling program. So I was from UUM, and I think there's one in UNISA, there's one in UMT, I think UPM is the oldest one, and then a few other universities in KL and Selangor. In terms of academia, that's a different story because counseling is like where you're going to a different profession. So academia is just going into the knowledge world, and you would need to have a PhD for that. That's the most ideal. What I did was I was going into counseling as masters, and I did health promotion, which is like a subset of public health as my PhD. So that's my route. And for other people, that you may go through the basic medical sciences, anatomy, physiology, pathology. So I got a few of them. Knows a few of them who go through that way. There are those who can go to medical education or go through the route of public health. But do bear in mind, some university won't accept a candidate for public health if you don't have an APC. So don't check with that first before you can go in. And once you've got your PhD, or either you're doing your PhD, you can straightly apply to work at any university in Malaysia. And being in academia is not about teaching, just to change the mindset a bit. You don't imagine teachers. You're not teachers. In academia, you are experts. So when you say you are experts, you share your expertise with your students, and you share your expertise with the community, and you have to do research. So that's basically scope of your job. So your KPI will not be just teaching. So you have community work. Here you have community engagement, you have a research project, you have publications, you have conference and whatnot. So whereby in a place where you are the experts, you have to share your expertise.
Oh, that's something new for me as well. Because all this while I thought academia means teaching.
Yeah, unfortunately, no. I mean, in terms of teaching, we only need to teach 12 hours a week. So imagine you have 40 hours of work days per week. So 12 hours is just a portion of that 40. Perhaps around 28%. So the balance of that is for the other things, whereby, like I just said, for you to share your expertise to other people.
Okay. Well, thanks, Dr. Nazir. I think this was a very in-depth conversation with you. I really enjoy listening to your stories, how you overcame depression and seek help, because I think seeking help, knowing when to seek help, that is the most crucial thing, because firstly, doctors, we try to self-medicate as much as we can. Yeah, seeking help is like the last on the list.
Yeah.
So yeah, well, we hope you've enjoyed hearing from Dr. Nazir about his transition. Not just his transition, but how he overcame depression and his transition through from clinical medicine to academia and counseling. So if you guys want to reach out to Dr. Nazir, you are on LinkedIn and
Yeah, I do.
and you have a Facebook page.
Yes, I do as well.
Okay, we'll keep that in the notes below. So yeah, remember understanding yourself and seeking guidance from mentor and knowing when to reach out for help when you need it is really, really important. So stay tuned for the next episode. Thank you for tuning in.